I'm delighted that you've chosen to view the film today of our annual report for the year 2015-16. The vision of Powys Teaching Health Board is to ensure truly integrated care centred on the needs of the individual. And throughout this short film, we want to share with you the work that we've been doing right across the Health Board to meet that vision and to ensure that we are serving the people of Powys really well. We're going to start with improving health and well-being. This has been a really good year for us as more and more of our activity focuses on how we stay well, how we maintain good health and well-being, or if we've been unwell, how we get back to our optimum, back to our best. And I wanted to flag two key things for us this year. One is the fantastic work of the Health Visiting Service down in Ystrad, who have been working with mums and young babies in a project called Splash Esprit. And so this important network supports mothers and families and importantly helps give our youngsters the best start in life. In terms of improving health and well-being, we are trying as staff at Powys Teaching Health Board to play our full part in that and taking responsibility for our own health. And so this year, well over 50% of our staff had a flu immunisation. Not only does this help to protect the individual member of staff, but it helps to protect family, friends and communities. And importantly, for those who work day in, day out with patients, helps to prevent the spread of flu. The next area I wanted to just share with you is our improving access and ensuring we've got the right access to services for the people of Powys. Now we try to provide as many services as we can close to home because we know that travelling out of county can often be very tricky and very challenging for people, particularly with public transport or if you're older and needing to get the support of other people to help with the transportation. One of the key things we've brought in this year is a new eye service for people with a condition called wet AMD. This service uses more specialist techniques and can be provided locally with the support of consultants from district general hospitals. Now this is just the start of this service, and so we anticipate that as this service grows we could be saving up to 100,000 travelling miles for patients who otherwise would have to seek services outside of Powys. So this is something we're really pleased with. Some of the other elements in terms of improving access will be virtual wards, and you may well have heard a little about virtual wards across Powys. It won last year the NHS Wales Award for Excellence. I'm absolutely delighted that during the year we have been able to move forward and put virtual ward services in place in more places across Powys. What it does is it supports people to remain at home when they become more unwell, and that support is often provided by district nurses, GPs, social workers, physiotherapists, pharmacists, social care, and very importantly, colleagues from the voluntary sector. The patients tell us this is such a huge improvement upon what the alternative was, which was a direct admission to hospital. So we're hoping that we can continue to support as many people as we possibly can through these new services. One of our other key aims is striving for excellence. And we know that just a few short years ago, such a big focus on the quality of care, in particular in reports such as Mid Staffordshire, really threw a spotlight on the quality and the patient experience. Now, delighted to be able to share with you that a comprehensive patient survey of the services in Powys has taken place. Over 600 patients participated in this survey, and they were able to say that they were satisfied with the service, like 98%. That means there's still some room for improvement, but I was certainly delighted to hear such positive feedback from patients, and that just goes to show the hard work of all the staff with other partners in providing such a great service. The other key areas that I just wanted to flag up to you relate to the improvements we continue to make on things like patient falls, and on pressure damage, also known as bed sores. Now, we know the damage that both of these can cause, both in terms of pain, but in staying in hospital longer and having more treatment than would have been necessary. So we've been pushing really hard to make sure that we can do all we can to prevent falls and to prevent pressure ulcers. And recent reports are indicating that we're really making good progress here. It's important for me to say at this point, I think, that we have a patient experience strategy and that the board hears on a regular basis the stories of patients who have had contact either with a direct service in Powys or one where we buy services from others. Now, there are times when these stories are really very challenging and the service has not been what we would have wanted or expected. But we try our best to make sure we take forward the lessons that can be learned from these stories and help to make sure that we improve day in, day out for the patients that are due to receive such services in the future. Hence, we take compliments and concerns very seriously. We like to make sure that staff receive those compliments where they're due, but also that we can spend time learning from things that haven't gone quite so well. I'm also delighted to be able to share work in relation to dementia care and the rollout of a butterfly scheme, which is helping to improve the care we provide. And this year, we have been developing a new dementia strategy with our partners in Powys County Council and the voluntary sector and communities themselves. In relation to involving the people of Powys, one of the things I've certainly felt since I've been working in Powys Health Board has been the real sense of community that exists in Powys. And it's important for us as the health board responsible for health and well-being and healthcare services that we listen, hear and act on what communities, individual groups and our other stakeholders tell us. We pride ourselves on our commitment to working together with Powys Association of Voluntary Organisations, for example, with Powys County Council, with our general practitioner and wider primary care contractors and our secondary care providers to ensure that we are working collectively for the benefit of patients and their families. Huge thanks to the third sector for all that they do in terms of providing services, but also more recently in helping us to plan for the future. The other key aspect is about our staff, and one of our aims is to do our development work always with our staff, and we've been working pretty hard to ensure that really staff become partners right the way through the organisation in our work across the health board. And our flagship engagement programme called Chat to Change has been at the centre of that. The Chat to Change programme has helped us to develop some new values and behaviours framework, something that is very important to the board and to our staff, and it's helped us to improve our communication, although there's always more to do, of course. I also wanted to bring to your attention the fantastic Staff Excellence Awards that we had this year. Over 100 colleagues came together to recognise where people had gone above and beyond, had worked hard as a team of the year and had brought energy, focus and drive right the way through the organisation. I know that we always want to make sure that our staff are celebrated and I think this year we had the best awards event ever. I wanted to just touch then on finance and general performance. In particular, the climate of austerity continues for public services, and that's true of the Health Board as well. But I am delighted to be able to report that a break-even financial position and financial stability continues for Powys Teaching Health Board. We continue to have a huge amount of commitment and support from Welsh Government colleagues. We're very grateful for that. And we've worked very hard to ensure that we can save money where we could and should, and that we've made investments, again, we're against our priorities as listed in our annual plan. I hope you've had an opportunity to view some of our other literature, and I would just direct you to the Health Board's website, where there's much more information about the workings of the Health Board. I hope very much you've enjoyed the film. Thank you to all those partners and to our staff colleagues throughout Powys who've helped us this year to provide services for the people of Powys. Thank you very much.